Hello, my name is Samarria Dunson, and I own Dunson Group LLC, which is a healthcare compliance and consulting firm in Montgomery, Alabama. I'm of counsel with the law firm of Balch and Bingham, and I work in their health law division. For about 5 years now, I've had a partnership with the Alabama Medical Association, where I educate Alabama physicians on HIPAA and high-tech regulations. Prior to starting my own firm, I was an assistant attorney general with the Department of Public Health here in Alabama. My job primarily was to regulate hospitals, nursing homes, and assisted living facilities. In my final 2 years with the agency, I was tasked to start the Office of Compliance and Ethics, and I served as the first director of that office. In that role, I played the privacy officer position for our county health departments, our state laboratory, and our All Kids health plan. Currently, in addition to healthcare compliance work, I was also appointed about 2 years ago as a municipal judge here in Alabama. So now I handle misdemeanor cases, DUIs, domestic violence cases, and shoplifting. I will be honest with you and say that prior to my job as a municipal court judge, I found HIPAA high-tech regulations to be extremely exciting. I now know that that may not be the most exciting work, but as you watch this training today, I do want to say that we will try to make this as entertaining as possible. We have some recorded skits that we'll play throughout the course of the training that will emphasize the subject matter and hopefully make it a little bit more lighthearted. You may be asking yourself, why is it that I have to listen to this training today? And the reason for that is that you work for a healthcare compliance entity, which means that you're governed by the HIPAA and the high-tech regulations. Now, for this specific training, if you are a nurse or a social worker, you can receive 1.5 CEUs in the state of Alabama. I know that the HIPAA regulations seem pretty voluminous. However, it really boils down to 3 rules: your privacy rule, your security rule, and your breach notification rule. Now, the privacy rules are pretty simple. It dictates how you handle paper records, how you handle your tone of voice when you're discussing patient or client data. The security rule is a bit different. It governs your electronic protected health information. Now, this is information that lives on your network server or in your emails, and it's very important that this information be secure so that you protect yourself from any type of cyber attacks. And then finally, your breach notification rule. And this tells patients or clients when they may be notified if you mishandle their data. It also governs whether or not the Department of Health and Human Services needs to be contacted, and in some cases for large-scale breaches, when the media will need to be notified as well. These are the topics that we'll be discussing today. The first thing that we'll be discussing is exactly what is protected health information. We'll also be discussing patient rights, and these are the same rights that you all have when you visit your physician's office or your dental offices. Uses and disclosures of protected health information, the ways that you'll communicate health data, insider threats, which is becoming more and more of an issue, teleworking pitfalls and tips, which a number of us have had to utilize during the COVID-19 pandemic, how you properly dispose of protected health information, cybersecurity threats, breaches of protected health information and electronic protected health information. We'll also have a HIPAA enforcement update. I'll be talking with you about high-tech amendments, and I'll introduce you to the Notice of Proposed Rulemaking. Now, you're watching this training because you either work for a healthcare provider, an insurance company, a healthcare clearinghouse, or a business associate. Now, most of those are quite clear, but our most recent one is a business associate. And you may be asking yourself, what is the function of a business associate? A business associate is any individual or entity who utilizes the health information of a covered entity to do something on that covered entity's behalf. So let's look at some examples of business associates. Business associates could be your IT vendors, those groups that come in and troubleshoot and look into your health data to make sure that they assist you into doing what it is that you'd like to do. Your billing and coding companies. Even my law firm is considered to be a business associate of a number of my clients. Another popular business associate are your record storage companies, those entities that come and pick up all of your data and collect it, and they hold that information for you until you need it or until a retention cycle is over. Also, your shredding company, entities that dispose of your data or your electronic health data. All of those are considered to be business associates. Whenever you have a business associate relationship, you want to make sure that you have a business associate agreement in place. A business associate agreement is simply a contract that you have with that entity, and that contract moves the liability to that other entity if they misuse or wrongfully disclose health data. So it's really important that you move that liability to that other entity in case any of their employees do something wrongful with the information. Now, if you have a business associate relationship and you're sharing your patient or client data with that other entity, if you do not have a business associate agreement in place, the regulations are clear that you're responsible for the breach. So you're responsible for the notice of the breach, and you're also responsible for any penalties associated with that breach. So that's why having a business associate agreement is extremely important. Now, as we begin our discussion about HIPAA and high tech, the foundation of it has to do with your protected health information. So as you can see from this slide, there are a number of different identifiers that are associated with protected health information. All of us are pretty clear that your name, date of birth, diagnosis, address, and social security numbers should not be shared. However, we also want to call to your attention that other account numbers or medical record numbers, even someone's email address or full face photo are all considered to be protected health information. So if your entity mishandles any of this information or compromises it, that could be considered to be a breach. The last factor that I do want to call to your attention as well is kind of an umbrella factor, and it's called other identifiers. What this means is that if a reasonable person finds this information laying around or they discover this information that is in the hands of your entity and they can reasonably identify the individual, that can be considered to be a breach of that person's information. One popular example that I like to give is a unique tattoo. So let's say at your physician practice, you've taken a photo of an individual and they have this really great and unique tattoo that maybe they got on spring break one year, and maybe they live in a rural county. Where if somebody picks up that information and maybe it has the title of your entity on it, and they pick up that photo and they're able to recognize that individual from that really unique tattoo, that could be considered to be a breach of that person's protected health information. Now, there are a couple of exceptions to protected health information, and that has to do with your employment records and your education records. So for employment records, remember, HIPAA is going to govern the activities of HIPAA-covered entities. So if you're working for a particular entity and maybe you're providing them information for FMLA and it happens to be medical records, just understand that HIPAA may not necessarily apply to that. Now, there may be policies and procedures that require that entity to keep that information confidential, and they certainly should keep the healthcare data in a separate file, but it may not be a HIPAA violation if your employer, who is not your medical provider, mishandles that information. And it's a very similar situation with FERPA, which is the federal regulation that governs education records. Now, FERPA is very similar to HIPAA. However, just understand that if you have kids and maybe you're giving your immunization records to the school nurse and they somehow mishandle it, that may be a FERPA violation, but it would not be a HIPAA violation. Now we're going to talk about patient rights, and we'll start by playing our first skit.
Good morning, ma'am. Why don't you go ahead and sign in for us?
I'm just here to get a copy of my medical record.
Okay, that shouldn't be a problem. I just need you to fill out this form so that we can...
You must not understand. I am not here to fill out paperwork. I'm here to get a copy of my medical record. It's my record. You've got it. I want it. You got to give it to me.
Yes, ma'am. We'll try to accommodate you in every way that we can, but first I need you to...
I know my rights, and I am not moving from this spot right here until you give me a copy of my medical record. Do you understand now?
Now, that skit gives us an opportunity to talk a little bit more about patient rights. Now, in that skit, the client was very upset because they wanted to receive a copy of their medical records immediately. And I will say this, in my experience, if you can bring the temperature down a notch and provide someone their records in a timely manner or at a time that they request, then certainly that's a good idea to do so. But you have certain patient rights that I want to make sure that you're aware of in terms of the regulations. The first right that you have is to be able to obtain a notice of the privacy practices. And the notice of privacy practices is really important. It's the entity's contract with you that says how they'll use and disclose of your patient information. Now, a lot of us go to doctor's offices, and I'm sure you probably share this, where you go and you acknowledge receiving a notice of privacy practices, but maybe never received that notice of privacy practices, or you don't really review it. It's very important that you view that document in its entirety so that you understand fully how that entity is going to utilize your healthcare data. Now, in terms of having a copy of your medical records, as we were talking about in the skit, that person was demanding a copy of their records right then. Technically, according to the regulations, the entity has 30 days in order to provide you with a copy of your medical records, and up to 60 days if all of the records aren't on site. So some entities use satellite offices, other entities may use record storage companies. So if all of the records are not right there at that entity, they can get an extension of up to 60 days. A right to view your medical records is also important. Individuals have a right to come on site to your facility and just view their medical record without paying for or requesting a copy of it. And when they do this, that has to be free, where they have an opportunity to look at it. And that's really important when you're thinking about electronic health records, because often the way that you would view an electronic health record, perhaps on a tablet, is very different than what that record might look like when it's printed out if they ask for a copy of it. They also have the right to limit the disclosures. So if they pay in full out of pocket for services, they have a right for you not to then share that information with an insurance company. They also have the right to request an accounting of non-routine disclosures. Now, routine disclosures are what we call TPO, or treatment, payment, and healthcare operations. Now, these are generally things that you're going to disclose on a regular basis, maybe to other providers for continuity of care. You may be disclosing information to Blue Cross Blue Shield or Medicare or Medicaid for as a payee of healthcare data. However, there are non-routine disclosures also. So maybe an attorney subpoenas a record, or maybe the Department of Public Health is doing some type of study or research and they need healthcare data. All of those are considered to be non-routine disclosures. And whenever a healthcare provider discloses that information for non-routine disclosures, they have to make sure that they red flag that information. And you have a right to come to them each year and ask them where they've sent your information as a non-routine disclosure. And then you have the right to provide information to third parties of your data. You have a right to confidential communications, which means that, hey, when I first signed up with this medical provider, maybe I provided my home address and my home phone number, but now I'd rather for them to communicate with me on my cell phone number or a PO box. As long as those are reasonable requests, the entity has to comply with it. And then finally, you have a right to make a complaint to the healthcare privacy officer or to the Department of Health and Human Services. What I always tell my clients, though, is whenever you think that there may be a complaint about HIPAA or high-tech issues, make sure that the privacy and security officer of your entity knows about it so they can begin to mitigate that and talk with that person about their complaint. Often, if a patient or client knows that the information is that in their complaint is being addressed locally, then they won't necessarily move forward with making a complaint to the federal government, but they certainly have the right to do so. Next, I want to talk with you all about the uses and disclosures of protected health information without individual consent. So this is when a healthcare provider or insurance company will freely provide information and the patient or client does not have to authorize those disclosures. First, of course, is when it's required by law. Second, for public health activities, which are extremely important, and we all are very familiar with those with the recent COVID-19 pandemic. Also, whenever there's a victim of abuse, neglect, or domestic violence, that information can be shared freely with the Department of Human Resources or with a police station or any other entity who by statute is required to receive that information. For healthcare oversight activities, this is when the Department of Health and Human Services may come in to do an audit. That may be one example of that. Also for judicial or administrative proceedings. So if you receive a court order from a judge or an administrative hearing officer, you would turn in information for that. Law enforcement purposes. Now, this law enforcement exception can be a bit tricky. because with law enforcement, you can provide a law enforcement officer with identifying information or characteristics about an individual, but you cannot provide medical information unless they have a court order. So for example, you may have someone who was in your office and their visit is over and the officer may come in and say, hey, I'm looking for John Doe. Can you tell me when their next appointment is? Well, that's information that can help identify the person, and you can share that information, though normally that might be considered to be PHI or protected health information. Also, you may be able to disclose how tall the person was or what they were wearing or what their address is. Now, clearly, that would generally be considered to be PHI. However, because you're using it to identify the person, you can share that information as well. Information on decedents, when they've passed away for a specific period of time, that's not considered to be protected by HIPAA anymore. For research purposes, information can be disclosed, but keep in mind that for research purposes, generally you're going to de-identify information. This means that that slide that I showed you with all of the protected health information on it, you would actually go through and redact all of that data. And once you do that, it's no longer governed by HIPAA and you can share that for research purposes. Always, you can disclose information to avert a serious threat of health or safety of another individual. And then also there's a specific workers' compensation exception under the HIPAA regulations. Now, the next thing that I want to discuss with you relates to how you disclose of protected health information. And we'll do that with the next skit.
Good morning, Miss Thomas. Yes, everything is going great here at the office. How's everything at your conference? You can't get the spreadsheet to open. Oh no. Let me get with IT and see if they can figure out what the issue is. You need it faster. Send it to your personal email? Are you sure about this? Okay, your personal email is whatnottodo@gmail.com. Got it. I'll send it right now.
In that skit, we chose whatnottodo@gmail.com purposefully. In that skit, there is absolutely no way that you should be sharing healthcare data to someone's personal email address. And so this gives us an opportunity to talk specifically about the ways that you should be communicating healthcare data. The first thing that I want to talk with you all about is your tone of voice. Depending on where you work, you may have patients or clients that are walking by and they may end up hearing a conversation that has healthcare data in it. So it's important to make sure that you keep a professional tone of voice. Also, for those of us who may work in an office setting and may not have patients or clients walking by, it's still appropriate for you to keep an appropriate tone of voice because you never know if you may have maintenance workers or other vendors that may be walking down the hallways and could overhear your conversations. I also want to talk about faxing procedures. The regulations are very clear on how you should be faxing patient data. First, you want to make sure that you have an appropriate cover sheet when you get ready to fax data and that it has a disclaimer across the bottom that informs a recipient that if they receive it wrongfully, that they must maintain the confidentiality of those documents, and it gives contact information for who they can call if that information goes to the wrong source. You also want to make sure that you're confirming the fax number of that entity before you send that information. Recently, I was handling a breach of an entity that they were pretty sure that the fax number that they were using was an accurate fax number, when what they found out is that it was an old fax number that had changed. So they were beginning to fax pretty large amounts of protected health information to the wrong source. So you always want to make sure that you're confirming a fax number if it's not a entity that you fax to quite often. Encrypted email is extremely important. This is becoming less of an issue now because I think that a number of healthcare providers understands the significance. But whenever you're sending a communication that has electronic protected health information in it, that email has to be encrypted. You also want to make sure that you're encrypting storage devices. So I know that a lot of us are using these portable storage devices. They're getting much smaller now and they're holding lots of data. But you want to make sure that those devices are encrypted, because if you have health information on those devices and you misplace it, or to get stolen, you don't want to have a breach on all of that information that is now wrongfully disclosed or maybe wrongfully disclosed. Now, this one I want to caution you about, and it has to do with your personal accounts. You never want to send health data to a personal account or receive health data to your own personal account. The same thing with text messaging. I know for a number of entities who go out to patients' homes, it's really easy to want to send a text message to say, hey, I'm going to be there in a minute, especially if you're out in a rural county and cell phone reception may not always be good. It's really tempting to want to send that text. But let me explain to you why you don't want to use personal accounts. As an attorney, I can tell you that whenever we're doing cases, whether it be a medical malpractice case or any type of case with litigation, what we generally do is we will subpoena all medical records. Now, when you begin to communicate with a patient or client, or even with your coworkers, and you're utilizing health data of this specific patient or client, all of that information can be subpoenaed. So if you're sending text message to a client, all we have to do is get our paralegal to send a subpoena to whoever your mobile service is, and we can receive all of the text messages that you've sent for that specific period of time. Now, that includes your personal text messages, because generally law firms don't say, hey, we'll allow you to go through the information first and we'll receive whatever it is that you'll share with us. No, whenever we send those subpoenas out, it's for specific periods of time. And then we generally will have a paralegal or an associate comb through all of your emails or comb through all of your text messages until we find the data that we need. So that's one reason that you definitely don't want to use your personal accounts unless you don't mind a paralegal maybe going through all of that data that may be subpoenaed later. Also, I wanted to share with you the issue of the U.S. Postal Service. So there is an exception under HIPAA for them. If you send out a mailing to a client or a patient and somehow it gets misplaced or they deliver it to the wrong place, rest assured that that exception exists for you if it goes to the wrong place. So you don't have to worry about counting that as a breach on your organization's behalf if the U.S. Postal Service is actually responsible for it. Now, you definitely want to note it for your records that this occurred, and you may want to absolutely tell the patient and client that it happened, but you're not responsible for any fines that might be associated with that breach. The next thing that we want to talk about is the minimum necessary rule, and we'll start that with a skit.
Hey, what's new?
Well, I guess you heard about what happened with Stacy.
No, what happened?
Well, our little Miss Perfect has gotten herself into some hot water. You know her client, Miss Smith, the one with all the family drama?
No, now you know I work in accounting. Is she the one with the hoarding problem?
Mm-hmm.
Stacy told me there's stuff everywhere.
Did you know that Stacy took a picture of Miss Smith's house and posted it to Snapchat? Somebody took a screenshot of it and sent it in as a complaint. In the picture, you can clearly see Miss Smith's prescription medication and paperwork that includes her diagnosis. It is a mess.
Now, this minimum necessary rule is extremely important. Now, as you saw during that skit, the person who was receiving the information said she worked in accounting. There was no reason for her to have all of this information about that client or patient. And so with the minimum necessary rule, it's really important because it has internal factors and external factors. So internally, you need to have a work-related need to know the information. If there's no work-related need to know, then you shouldn't be sharing healthcare data, even within your organization. Within your policies and procedures, there should be disciplinary action for people who behave in that manner. Now, there's an external factor of minimum necessary rule as well. So externally, you only want to provide other entities with the information that they request. So one example of that would be maybe for continuity of care, another healthcare provider may ask you for specific lab results or case management notes. In those instances, you have to provide them specifically what they ask for. You can't decide, hey, I don't have time to go and pull out the exact data that they requested. So I'll just provide them the entire file, or I'll just provide them all of the information for specific dates. That would be a violation of the minimum necessary rule also, which could be subject to discipline. Now, I also want to talk with you all about your volunteers, your interns, and your medical residents. You are going to be just as responsible for those individuals as you would for anybody that is employed by you. So it's really important when you have these volunteers or interns that they receive the same training that your employees do, and that they sign off that they have reviewed your HIPAA and high-tech policy. So if they do anything to inappropriately disclose someone's health data, then you would be in a position to defend yourself to the Department of Health and Human Services during an audit to show, hey, this person acted outside of the scope of what we were asking them to do. They were trained in this manner and they reviewed our policy. And also with visitors, it's really important to have a strong visitor policy and procedure so that people are being escorted and they're not wandering into areas that they don't belong or viewing information that they don't need to view. Now we're going to talk a little bit about social media. Now, a long time ago, back in 1996, when HIPAA first came out, we were talking about paper records or people kind of what we call talking out of school and telling their neighbors about different information. Now, in addition to cybersecurity issues, one of the biggest things that we're seeing come up and trending is social media disclosures. Now, I know all of you all are receiving training on HIPAA, and certainly you've reviewed your HIPAA policies. But one thing that I've seen from experience is that when we get into these arguments, or especially heated arguments on social media, many people forget all of the training that they had or any of the policies and the procedures that they've reviewed, and it's just all gloves off. I've handled several breaches, especially during the pandemic, where individuals have gotten into arguments and they began disclosing someone's health data within those arguments. So I want to share this with you. Don't communicate about health information on social media at all. Don't even disclose when someone's appointment is. If somebody sends you a Facebook Messenger request and they're asking, hey, I think my appointment might be on Tuesday, it doesn't matter if you went to high school with that person or if you're really good friends with them, you should not be disclosing any type of health data through social media. The ways that I would respond is I would do two things. The first thing I would do is say, hey, if you're meaning to communicate with, and you list out the specific entity that you work for, perhaps you want to call them on Monday between the hours of whatever and whatever. Just giving them, you're being friendly and you're being kind, but you're letting them know that they'll need to contact the office if they want that information. Another thing that you can do is not respond at all. And you may choose to do either of those two things because if you begin communicating with them on a social media platform which is insecure, that could be considered to be a breach of your patient or client's data. Even with Snapchat, which is one of those things that we've kind of seen over time where people believe that that information is really going to go away, always remember that with electronic media, nothing ever really goes away. And what we're seeing is people screenshotting things that are coming up on Snapchat so that they have that information later. And I've even seen a situation where someone sent that screenshot of Snapchat into the person's employer, which obviously began some disciplinary action for the individual who placed it out on social media. So you want to be really, really careful about that. Now, this next skit is going to give us an opportunity to talk about public Wi-Fi.
Finally, moment of peace. I can sip my cup of joe and work at my leisure. All right, where's that Wi-Fi password? There it is. Wi-Fi password, coffee shop number 1. Well, that's easy enough.
So in that skit, obviously a number of us are working from home, especially with the pandemic. We've found many advantages to being able to be really efficient when we're not in the office. But public Wi-Fi is something that we need to be educated about, and as an entity, we need to be concerned about. So first, you want to make sure that you don't access your personal or financial information whenever you're on public Wi-Fi. And this includes the information about your patient or clients that you may have as a result of being employed by your organization. Another thing is to log in or send personal information only to websites that you know are fully encrypted. A lot of times what you'll see is HTTPS, and that S at the end lets you know that this is a much more secure network. But you also want to be careful with that, because a lot of what we call bad actors or people who are looking to participate in fraud, they'll create websites that have HTTPS on it, and they kind of fool the user into thinking that it's a secure site. So whenever you're on public Wi-Fi, make sure that you're communicating with websites that you already fully understand or that you've utilized before. Also, don't stay permanently logged into accounts. A lot of times that option will be available, and you want to make sure that you're not doing that. One thing that's really important is not to use the same username and password for multiple websites, because if a bad actor ends up compromising one of your usernames and passwords for one site, they'll go and test out a number of other sites that they think that you might be associated with. And that can kind of be a gold mine if you're using the same username and password for each site, especially if they're able to break into your personal email and they see, oh, this person banks with this specific bank, or they're using Amazon or Publix or any of those other entities that you may be utilizing usernames and passwords for. So you want to be really careful about that. You also want to change your device settings so that it doesn't automatically connect to nearby Wi-Fi's. You want to make sure that you have a significant amount of control over them. And then also, especially when you're talking about patient or client data, you want to be using a VPN, which is a virtual private network for those communications. Now, the next thing I want to talk with you all about are insider threats. And these are extremely important, especially as we have more individuals within our workforce who work remotely. And as people have more and more issues economically, then these kind of insider threat activities become much more attractive to otherwise good people who would otherwise not compromise a patient or client's data. So insider threats are those individuals who may be current or former employees, contractors, or business associates who have authorized access to your patient and client information. And over the last several decades, this has become more and more of a trending issue for organizations. So I want to make sure that you fully understand what these insider threats are capable of. The first one that you see on this slide talks about employee or contractor negligence. Now, this is mainly human error, and it's the most widespread type. And generally, in terms of costs, this could cost an organization, on average, $310,000 to deal with this type of human error type of disclosures. The next thing that we have is criminal or malicious insiders. Now, these are much more damaging to an organization because these individuals typically know everything about the cybersecurity measures of an organization and the sensitive data that that organization protects. And they leverage that knowledge in order to compromise the patient and client data of that specific entity. Now, mitigating the consequences of malicious activity can generally cost about $760,000. Now, for credential theft, this is the big one. For hackers, stealing the credentials of a trusted employee is one of the best ways to get inside of an organization's protected perimeter. They're generally going to go back to management, CEOs, individuals that are on the board, anybody that has more than the general knowledge of an organization and access to data. So generally with those, they're going to cost an organization on average $870,000. So with insider threats, there are some hotspots that I want you to be aware of. The first thing has to do with termination procedures. We see disgruntled employees as one of your largest insider threats. These people are angry with the organization. They are generally meaning to destroy it because they're not leaving voluntarily. They're being terminated and they want to get back at the organization. So a lot of times what they'll do is maybe they're moving on to a healthcare provider. So they email themselves patient data so they can then get referrals as they move on to that other organization. or they may want to delete files or otherwise compromise the integrity of your data. So it's really important that when you know you're going to terminate an individual, that they not have access to their computer after they've been terminated, that you remove all of their passwords from the system so that they're not able to get in remotely to those areas anymore, that you take their keys, that you change any outside codes, take their badges. And also a mistake that I see entities make the most of in terms of terminating procedures is they don't always inform the other employees within that organization that that person no longer works there. And you definitely don't have to say why it is that the person was terminated. In fact, I would recommend that you not. But of course, you do want to say, hey, everybody in accounting, hey, everybody that may not necessarily work with that person all the time, we just want to let you know that this person has separated from our organization and they're taking other opportunities. And you want to do that because otherwise these other employees who used to seeing John Doe all the time would hold the door open for him or unlock their office for them or anything like that if they presented themselves to the organization after they were terminated. Another thing that I see as a hot spot for insider threats is this issue of ownership. A lot of employees believe that if they come up with a certain Excel spreadsheet or a certain mechanism for doing things, that they own that data or they own that information. It's important to understand that all of the work that you create while you're working for your entity belongs to that entity. It is actually criminal for you to take health information with you when you're separated from an organization. And then finally, the disposal of protected health information for insider threats. Negligently or purposefully, people will just start throwing papers away when they're cleaning out their office. They'll take a business-owned cell phone with them when they get ready to leave that may still have patient or client data on them or emails that contain that type of data on them. You want to make sure that they're disposing of that electronic data and paper records in an appropriate manner whenever you have someone that's separating from your organization. Now, there are behaviors that you should be on the lookout for in terms of these red flag behaviors. The first thing is people that want to work odd hours without authorization. They're notably enthusiastic about overtime work. They generally don't want to be out of the office and don't want to take vacation days. There are also people who remotely access the computer networks while on vacation or while they're on sick leave or other odd times. Maybe they're remoting in at 4 a.m. or they're remoting in at 7 p.m. at night. You want to be curious as to why it is that that employee is doing that. People who have interests outside of the scope of their duties. So maybe they're in one division and they're asking, well, what kind of records does this other division have? And how is it that those employees access those records? You want to look out for individuals who have unexplained affluence. You may want to look out for individuals who have unexplained affluence, which means that they may be buying things that they can't afford or maybe outside of their household income. Also, you want to be on the lookout for people who want to take information home when they don't have a work-related need to do that. So maybe they're taking paper files home or they're taking electronic tablets that they don't necessarily need for use at home, but they're wanting to take those home with them so that they can use it outside of the office. People who are overwhelmed by life crisis or career disappointments. These are people that you want to be on the lookout for as well. Also, and I'm sure some of you all may have experienced this, is people who are paranoid about being investigated, or they believe that there are listening devices around their cubicle or within their office. These are people that you want to pay attention to for these red flag behaviors. And then also, and this goes back to that negligence conversation that we had before, is people who disregard computer policies and procedures. And we all know those people who actively do that. They never really change their MO, but it certainly can compromise your systems. So it's important for you to have refresher training for those individuals and discussions with them, even disciplinary action at a point, if they continue to disregard your computer policies and procedures. Now, there are certainly ways that you can reduce this threat or this risk. The first thing that you want to do is to appropriately manage your employees. And you want to be mindful of the security access privilege designations that they have. And that goes back to that minimum necessary discussion that we had earlier. You want to restrict your employees to the data sources that they need to do their job. You don't want to give them any broader range of your patient client data than they actually need. You also want to proactively audit their access. So if you have a swipe system to get in and out of your building, if you have information systems, you want to make sure that you're auditing them to see, are there people who are trying to guess passwords for other divisions or certain information systems? All of these things are important. It's important not only to have them in place, but it's important to check them regularly, at least quarterly, so that you're able to gauge whether people are trying to compromise your systems. You want to make sure that you develop and adhere to these effective termination procedures that I discussed earlier. You want to engage in effective training. And you want to be mindful that all insiders are not necessarily in your building. For instance, those business associates, like your IT vendor, they could be considered to be insiders and pose an insider threat to your organization. They also have access to your patient and client data. Now I want to speak with you all a little bit about the proper disposal of PHI and electronic PHI. Now, all of us should be familiar with how we dispose of paper records. And I know a number of you all who have received training before you're probably thinking, why are we still talking about disposing of paper records? And the reason for that is people are still creating breaches by doing this wrongfully. There are people that believe that if you have a recycle bin and you just put the patient data in the recycle bin, that it's all pretty much going to the same place as the shredding companies. And that is not true. Whenever you are ready to dispose of paper records, you want to make sure that you either put them through a shredding device yourself, or that you put them in a locked shred bin, and the business associate that you have a contract with will come and pick up those bins and appropriately dispose of that data. Now, for electronic records, that's also extremely important. Let's say that you got a brand new laptop. So now the laptop that you used to have that contains electronic protected health information, maybe you want to donate that to a charity or otherwise get rid of it or retire it. You have to make sure that you provide any electronic devices with protected health information on it to your security officer so that they can either appropriately wipe that device of the electronic data, or they can destroy the hard drive in that device so that you're not subject to a breach or that information cannot be otherwise compromised. Now, teleworking pitfalls and tips have been really fun during the pandemic as many of us moved towards a remote workforce. The pitfalls to those could be a loss of connection to the network, which I'm sure a number of us have experienced over time. Also makes you more vulnerable to malware attacks and viruses. The theft of the property becomes an issue because as you're traveling back and forth in the office, many of us are stopping at Starbucks or we're stopping at a gas station, and we have those devices in our car and they could be stolen from us. So you have to be careful about that. Physically damaging the devices. I know, especially at the beginning of the pandemic, when everybody was at home, including our pets and our kids, it was more likely for those devices to fall on the floor or otherwise be physically damaged. Conversations can be overheard. If you're working in a home office and another family member is walking through the home, you want to make sure that you're keeping that appropriate tone of voice. The disposition of documents upon termination. Most of my clients who have employees that work from home now have either a shred bin at their house or a lockbox that they can secure that data until they can bring it in and put it in the appropriate shred bin in their offices. And also sharing of work-issued devices containing this PHI or electronic PHI. And this means, allowing your kid to use it so that they can draft their essay or anything like that. You definitely don't want to be sharing these devices that you have that should be exclusive for your work environment. Now, there are some tips that I'd like to share with you. Always use VPN. And we always think of a lot of this electronic stuff in my office as magic in a way. It's always surprising to us how information technology moves so fast, but we often think of this as an encrypted tunnel. So it's important that you utilize a VPN when you're working remotely. You also want to limit the access to the minimum necessary, use multi-factor authentication or strong password protection. So no longer are we using passwords that say password 1 or password 2 or your street address. All of those things are easy to guess. You want to have removable media encryption, that portable storage devices that we talked about earlier. You want to make sure that all of those are encrypted. I have clients also who are disabling printing for workforce employees who have no need to print healthcare data. Maybe they're using and they're manipulating that data within their information systems, but they have no reason to actually print that data. So they're disabling that, which I think is a really good idea. You also want to make sure that employees are signing remote access confidentiality agreements, and you want to log remote access activity to make sure that everybody's logging in at appropriate times and that they're only going into information systems that they are designated to utilize. Now, there are some recurring cybersecurity threats that I want you all to be aware of. The first is phishing, these phishing campaigns that have gotten so sophisticated. Malware and ransomware, which are often introduced because of these phishing campaigns that come in through our emails or attacks on our network systems. Smart devices and electronic medical records are trending as an issue. And then third parties, because what these bad actors, what they're realizing is that a lot of these healthcare providers and insurance companies are doing everything that they can to get IT vendors to secure the data, firewalls, all of those things, encrypted information, everything. But the third parties are those business associates that you're sharing healthcare data. They're still trying to catch up. And so they're much more vulnerable. So they're trying to figure out who those third parties are, and they're actually going after those vendors. Now, this next skit is going to show us exactly how easy a ransomware attack can be.
No.
Yes, yes, yes.
What are you guys talking about?
Hall & Oates. He thinks that Maneater is their greatest song, but everybody knows it's You Make My Dreams Come True.
Who is Hall & Oates?
Maybe she'll know it when she hears it. Come here. Ooh, username and password right there. That's convenient. Never. Okay. All right, internet freemusic.com. Yes. Yes to everything. Give me the music already.
Wait, I don't think we should be accepting all of these without talking to the security officer.
Blah, blah, blah. This is Hall & Oates we are talking about. Wait, what is this screen? Your files are encrypted. To decrypt your files, send bitcoins to the following wallet within 24 hours?
Oh my gosh, is this a ransomware attack?
I don't know. Check your computers real quick. Make sure it hadn't impacted the network. Think.
Mine's fine.
Mine's fine.
Good. Okay, we don't need any problems. I am going to lock this computer and we are going to back away. We haven't done anything. We haven't seen anything. Got it?
Got it.
Good.
Let's get in
All
there.
right. Nope.
So that skit shows you just how easy it is to become the victim of a ransomware attack. They were just simply trying to listen to some music. Most of the time, employees are doing things that innocently enough, however, it's causing their systems to be vulnerable. Now, in that skit, they tried to clean everything off. They even wiped their fingerprints off to make sure that nobody knew that it was them. That's the last thing that you want to do. If you think that you've compromised your network, you want to make sure that you're turning the system off, that you're notifying your IT vendor via your security officer immediately. You also want to make sure that you're notifying the privacy officer, because as you notice in that skit, they gave them a ransomware warning. They're saying if you don't send these bitcoins to this specific place within a specific period of time, they're going to continue to manipulate and hold your data as ransom. Now, the federal government has been talking about, and I actually agree with, a requirement of not paying ransom, where it would be illegal for entities to pay the ransom. And that's really important because it really can shut down a lot of these ransomware attacks, because what is happening is that a lot of entities believe that if they pay the ransom, especially if they pay it quickly, they somehow believe that they won't have to count it as a breach. The federal government has been very clear that from the moment that that hacker gains access to your data, everything that they gained access to is considered to be breached. And you have to do breach notification for that. You may have to pay fines for that. So it's really important that you have backup systems so that your entity can continue to operate appropriately. Because even when the ransomware attack is over, maybe you've paid the money and maybe they give you back the data, there's still a question about the integrity of the data. Because now that they had that data, who's to say that they're not changing diagnosis on client information or deleting certain information or not providing all of the information back to you appropriately? So these ransomware attacks are a really, really big deal. This slide will help us have a good understanding about phishing emails. This is just an email that I got to my Hotmail account. And yes, I'm that old. I have a Hotmail account as my personal email. And I received this email randomly. And I just want to kind of go over with you some of the things that made me curious. Jessica, everybody knows somebody named Jessica. Everybody knows a nice person named Jessica. The first thing I did was just kind of hover over the name, and it's showing me that this isn't from Jessica at all. It's actually from some unknown entity or individual to me. It also has things on its face that look funny. It says congratulations and welcome, which isn't necessarily something that I would expect to receive. There's not enough information on the email for me to gain any understanding of what it wants from me or wants me to do. And so naturally, what they want you to do is start clicking on these links. And when you begin clicking on the links is when ransomware and malware can be introduced into your system. There's also some grammatical errors that are associated with the email that makes it look funny. So whenever you receive these types of phishing emails to your work email account, make sure that you notify your security officer immediately so that they can send out a notice to the other individuals within your workforce and they can kind of be on the lookout for it. Fortunately, these phishing emails from some of my larger scale clients are declining. And that's because the IT vendors are doing a really good job of making sure that they ward off these types of emails before your employees actually even see them. But there are instances that they get past that. And so you want to be very, very careful that your employees know how to recognize these types of phishing emails. Now, there are some additional security risks that I want to share with you. The first has to do with the unauthorized use of system usernames or passwords. This is generally where you got the Post-it with the, as you saw before, with the person's username and password on it just right there. Or even innocently, you got somebody that's working on the weekend and they need to get into a system. So somebody shares their username and password with them. That is a security issue that is concerning. Even more than that, in my opinion, has to do with these weak and ineffective usernames and passwords. So as I discussed before, they may be the person who has password as a password or even password with the year behind it, or individuals who utilize the same password and they just changed the number at the end. So I know a gentleman who thought he was pretty fancy. He used his wife's maiden name, and every time they had to change their password for work-related reasons, he started with one and he would do, Donaldson 2, Donaldson 3, Donaldson 4. Well, that is pretty ineffective over time, especially as you have IT vendor employees who move on and they may have an understanding of what your patterns and your password might be. That's very concerning. Also, the loss or theft of unencrypted equipment. So these are flash drives, portable storage devices, laptops, any of those types of things that are not already encrypted. And one thing I'll caution you about that I see some clients do from time to time, they'll invest in laptops that have encryption software on them, but then forget to actually turn that encryption software on. Well, it's only useful to you if you actually have it on and it's actually working. So that's important that your IT vendor ensures that that encryption software is turned on. Now, this is an entity that I like to talk about regularly. I'm kind of infatuated with research on this organization. So back in 2020, I started discussing these in my training, and it's Black Hat DEF CON. So Black Hat DEF CON is an organization. They typically meet in Vegas, which is one of my favorite cities, and they have conferences just like we might have a healthcare compliance conference or a nursing or social work conference. They have different tracks that they utilize. It's very organized. They may have individuals from the FBI there. They may also and do also have individuals who participate in hacking activity there. And the point of this conference is to share data. They have tracks that deal specifically with artificial intelligence or medical record billing, all of these types of things. And they're sharing these type of mechanisms that they may use to hack into certain organizations or certain systems. They also have opportunities for you to lease certain hacking software. So if I'm somebody who wants to cause some type of fraudulent behavior, I don't have to start from scratch. I can go and contract with this other entity. Maybe I get paid, maybe I pay them in Bitcoins, and they give me the infrastructure that I need to begin my hacking activity. And they may lease it to me for a specific period of time. Black Hat DEF CON is extremely interesting because during the pandemic, it was so important that the attendees remain anonymous, that if people couldn't pay cash, they would just allow them to just come and participate for that year while they had their virtual conference. But I can share with you that in 2021 and now in 2022, they are back in person. That conference is scheduled for August of 2022. And so these issues that we have, not only with Black Hat DEF CON, but other similarly situated organizations who rely on this type of hacking activity and sharing information among bad actors, is going to be something that we're going to be concerned about for a long time. Now, breaches. Breaches are the impermissible use and disclosures that compromise the security and the privacy of protected health information and electronic protected health information. So I want to go over with you some data that I think is pretty interesting. So there are certain breaches that we call mega breaches, and those are breaches that affect the data of 500 or more patients and clients. And so what we're finding is that whenever you have this type of large scale breach, it has to be presented to the Department of Health and Human Services or reported to them. And they've been collecting data on how many of these large scale breaches that they get each year. Now, these are just the ones who are actually reported appropriately. Many other entities try to be very casual and don't report it, just hoping that HHS never finds out about it. Of course, those entities who don't make those reports and don't appropriately mitigate it as they're required will receive much higher fines than those who actually report it as they're required to do. But if you see from this slide, those reports of these large-scale breaches are growing over time. And in 2022, with an increase on IT and hacking activity, we're expecting those large-scale breaches to continue to grow because, as you know, most people are not gathering large amounts of paper records anymore. The big data is actually stored electronically. So if they can get into your network, if they can get access to a laptop, any of those things, they're going to create these larger scale breaches. So we're expecting those numbers to increase in 2022. Now, as you can see, hacking and IT incidents are getting much larger as well as a primary source for these large scale breaches. Now, this slide I think is really interesting because this data began to be collected back in 2009. So since 2009 through the end of last year, you'll see that hacking and IT related issues accounted for 43% of these large mega breaches. And then unauthorized access and disclosures, these kind of general breach activity accounted for 26%. Theft was 22% on average over the course of 5 years. But look at just this year in 2022. Hacking has almost doubled, hacking and IT issues just at the beginning of this year. And then, of course, unauthorized access and disclosure is beginning to go down. Theft is going down significantly, mainly because a lot of the issues that we're having with theft are relating to devices that are encrypted. A lot of healthcare providers are making sure that they're turning that encryption software on and that they have that available to their employees. And the great thing about encryption is if you have a device that is encrypted, you don't have to count that as a breach ever. So if you're on the interstate and your laptop just kind of falls out of your car, or if you leave it at Starbucks, if that device is encrypted, you may have an issue with your property manager within your organization because they have to buy a new laptop, but you don't have an issue with HHS because that's not considered to be reportable. You also don't have to report that to a patient or client because when it's encrypted, it's considered to be non-accessible. Now, the locations of these breaches, I believe, are also pretty interesting. So as you can see, trending over time, emails have been a big issue at 21%, network servers at 26%. But just look at this year alone. What we're seeing is that 24% are now coming from emails, but a much larger portion from network servers are occurring during 2022. Now, breaches can be intentional or unintentional. Sometimes we may send an encrypted email to the wrong place. A lot of us over time, if we're working with protected health information, we're gonna make a mistake. We may send a fax to the wrong place. We may leave some paperwork somewhere that we didn't intend to use it or to leave that information. However, it's important as soon as you know that a breach may have occurred, that you notify your privacy and security officer because they'll begin to do what we call mitigation of a breach. And it's really important because for our clients, what we generally will provide them with is this objective tool. And as they go down and they answer the questions within that tool, it's going to give them a number. And that's going to help them assess whether it's a low breach, a medium breach, or a high level breach. All medium and high level breaches need to be reported to the patient and the client and also to HHS. But if your privacy and security officers can document that it's a low level breach, or what we also think of as a low risk breach, it may be possible not to have to do that breach reporting. The only way you get to a low level breach is if they're able to jump on it immediately and begin to get that information back. And here's an example of that. Let's say if I'm the privacy officer and an employee sends some data to the wrong email, and we know maybe who the recipient is, I may call that entity immediately and say, hey, do you have a young lady named Jane Smith? Can I speak with her? When I have an opportunity to speak with Jane Smith, I may ask her, did you receive an email from this particular source? In my experience, often they'll say, yeah, I saw that, but I didn't open it because I didn't know what it was about. Or I did open it, but it wasn't any information that I thought that I needed. So I went ahead and disposed of it. Often what I'll do as a privacy officer in that instance is send her a document that she can sign that lists on this date she received the email, she disposed of it, she doesn't remember any of the data in the email, meaning name, date of birth, social security number. It's also important to note whether or not that wrongful recipient works for a healthcare provider or an entity that is covered by the HIPAA regulations. All of those things together can help to mitigate that breach and lessen the opportunity of it being further exploited. There's criminal liability for wrongfully breaching someone's healthcare data. And I'll go over that slide with you in a minute. But be mindful that most often the criminal liability associated with HIPAA high-tech regulations is federal time. So they're going to be federal charges. These are generally going to be felonies. And often when I've seen people have a felony and they go to jail for HIPAA high-tech related issues, they spend several years in federal prison without getting out early for good behavior. So it's important that you not participate in that type of criminal activity. And also be mindful that even though something may be subject to the HIPAA high-tech regulations, they may also be subject to state statutes. So for instance, mental health records or records associated with communicable diseases like sexually transmitted disease records, those could be misdemeanors or other charges that you might get in state court, which could cause you to have other types of criminal liability. So be very, very careful that you don't participate in breach activity. And that if you do find that you may have caused a breach, that you appropriately mitigate it and that you're fully transparent. Now, there's some breaches that are we often consider to be associated specifically with travel. And those are the disposal of paper records, encrypting those electronic devices, and reporting lost or stolen devices. Now, we've kind of gone over the first two already in our discussion today, but the report of lost or stolen devices is also important because in addition to that cell phone that you may have from work or that laptop that was issued to you, you may also have a swipe device, a swipe card or a fob or other things that allow you access to your building that has electronic protected health information in it or other types of healthcare data. If that information is lost or you believe that it might be stolen, report that immediately to your privacy and security officer so that they can begin to address it. I can't tell you the number of clients that I have who have members of their workforce lose one of these items that I discussed and not say anything for a couple of weeks. As long as they're able to get by doing their work, they're assume that it'll come up. Maybe they left it in the trunk of a spouse's car, or they think that it might be there. And as they're just kind of looking for it over the course of several days or sometimes several weeks, all of that information is subject to someone inappropriately finding it and doing something wrongful with it. So you want to make sure that you're reporting it in a timely manner. Now, civil monetary penalties are important. As you can see from this slide, it can be really expensive to breach someone's healthcare data. If an entity didn't know, and this was basically their first time that this has come up, they're just ignorant about the regulations, they can have a fine anywhere between $119 and $60,226. Then, as you can see, it increases with culpability. So if they have reasonable cause or willful neglect that they corrected, obviously those fines are increased. Now, the largest fine that you can get is willful neglect, which means that you've kind of thumbed your nose at the HIPAA high-tech regulations and you didn't even correct the behavior. And believe it or not, there are a lot of entities who fall within that category. And that's why it is that you see these fines for HIPAA and high-tech issues being in the millions and millions of dollars. Oftentimes, though, hundreds of thousands of dollars. And most entities cannot afford that type of liability. Because one thing I want to share with you, too, as we're talking about fines, is that many of you all may know attorneys or people who litigate cases, and maybe they receive a verdict and then maybe they'll settle it while it's on appeal, maybe for a smaller amount of money. Well, with these HIPAA fines, the entity actually writes a check for that specific amount of money. So you may see a fine that's $30,000 for a small single practitioner. Well, $30,000 doesn't sound like a lot in comparison to those entities that receive $1,000,000 fines. However, for a smaller organization, writing a check for $30,000 because of a breach that they didn't even anticipate clearly can cause a challenge for that organization. So you want to make sure that you assist your organization and insulate them from this type of liability with fines. I talked with you earlier about criminal penalties. This is some of the jail time that people may receive. So reasonable cause and no knowledge of the violation, which means that you are basically just being used. I see this all the time where you have a group of bad actors and they're meaning to create this fraud scheme and they just need somebody to get them the data, to introduce that flash drive into the information system to gather that information or otherwise give them information on patients and clients. Those people who are just, really ignorant and being used can sometimes receive up to a year in jail. Obtaining protected health information under false pretenses can get you up to 5 years in jail. And then obtaining for personal gain or malicious intent can be up to 10 years in federal prison. Now, here are some of the HIPAA compliance issues that are recurring, which means that these are things that as a compliance expert, I deal with year in and year out. The first was the individual rights of access, which goes back to that patient rights slide that we discussed earlier. A risk analysis, which is something that our firm does for virtually all of our clients, where we go through and we find out all of the information systems that they have that have electronic protected health information in it, how vulnerable those information systems are, and we provide them with some guidance on how to protect that data in the future. Access controls and audit controls continue to be an issue. Entities not appropriately reviewing their system activity. A lot of us have these fancy audit systems, but if we're not reviewing them and then proactively doing something about it, that becomes a shame. Business associate agreements that we discussed earlier are a recurring issue. People not identifying those relationships appropriately. And then, of course, breach notification. We have a lot. I end up getting a lot of clients who have a breach. They don't go through the appropriate breach notification steps, and then we're brought in to kind of clean that breach up. Now, there are some proposed rules that are coming down. We're anxiously anticipating them, and as they are become finalized, we'll make sure that our clients are aware of those finalized changes. But just to give you an idea of what you might be expecting, these are some of the things that we're looking at closely for our clients with these proposed rulemaking. The first thing has to do with the client's right to inspect in person. The proposed rules now will make it so that your client or your patient, if they want to view their medical record, like we discussed under patient rights, they'll have a right to come in, a legal pad or notebook. They can use their phone to take pictures or video of the electronic record or the paper record that you have on site. It needs to be readily available so that if they're seeking treatment that day, they don't have to come back for another appointment, or of course they can make an appointment to come see them. Also, there's a right now that you can't just provide them a summary if they ask for a copy of their medical record. So that's really important. It also prohibits unreasonable measures that may impede access. So that's going to be something that we're looking at. And then one of the things that I see as most important for my clients is that it shortens the amount of time to provide someone with copies of their records. So what used to be 30/60 is looking like it's going to be 15/30, and I'll explain that. Normally, if you're going to provide someone with a copy of their medical records, as we discussed earlier, you have 30 days to give them a copy, 60 days if it's not all on site. Well, with this proposed new rule, you would have up to 15 days to provide them with a copy and up to 30 days if all of the records are not on site. And this is actually really good for patients and clients who really want to be able to take a more active role in their healthcare decisions because they'll have the information that they need as they move on to specialists or other providers. They'll also have a right to make an oral request in addition to writing for copies to be provided to third parties or even third-party apps. And the proposed new rule goes in a good bit on how they're going to treat these personal health applications that have become so popular. The forms of access, there's some clarification on what is readily producible. So let's say you have a small physician practice and they don't do a lot of electronic data collection. A lot of their stuff is paper, but a client may ask to have their information provided to them electronically. There's been this compromise that a PDF, if it was scanned in as a PDF and emailed to them or provided to them on a flash drive in that way, that may be considered to be readily producible, and we'll continue to follow that. It also addresses these personal health application transmissions. Now, fee adjustments. Now, these are going to be really important, especially to those of you all who work in accounting. The fee adjustments for this proposed new rule is for in-person inspection. Of course, that's free because that's just the person coming on site and viewing. But let me be very clear. In all of the policies that we draft, for years, we've put a section in there on people's right to view because they've had this right for some time. But we also put in the policy that somebody has to be with them the entire time that they're inspecting their record or viewing their record, because you want to make sure that they're not omitting anything, that they're not changing anything, or otherwise affecting the integrity of that record. Now, for internet-based records, now these are often those patient portals that we look at. Those have to be free. And there is an exception, though, that if you're requesting paper records through a portal or other internet-based system, then you do have to pay for the copies of those paper records. There are also some other fee adjustments that we're going to be monitoring and looking at, and you can see those from this slide, and I won't go further into it, but we'll continue as that proposed new rule becomes finalized to keep all of our clients up to date and amend your policies and procedures in accordance with the way that those rules are being finalized. Now, there are some notice requirements for access and authorization. So if you have a fee schedule, you have to post it on your website. If you have a website, you have to provide a copy of your fee schedule upon request. You have to provide individualized estimates of fees for copies. And then also there's a prohibition on upfront payment. So they can't require you to give them the money before they begin to start providing those copies to you. Now, this one is important. It's a prohibition on unreasonable identity verification requirements. There have been some entities that will require an authorization to be notarized before they will provide a third party or a patient or client with their own records. And that is considered to be unreasonable, especially because there's charges generally to have a document notarized. And then in some rural areas, it may be difficult to find someone who will notarize a document. So they're going to prohibit that. And they're also going to prohibit in-person proof of identity. And that means that if I want to send an authorization request, I can just make a copy of my driver's license and send it in. I don't have to present in person to provide a copy of that. Now, this one is really important as it relates to substance abuse disorders to avert a serious threat of health or safety. It used to be that a provider could use their professional judgment to decide if they're going to make that disclosure. Now it just needs to be a good faith belief. And that is a really important clarification. Then also, they don't have to anticipate that the threat is serious and imminent. That's now being replaced by reasonably foreseeable. So if they reasonably foresee that there is a serious threat to health or safety, then they're able to make specific disclosures. And those are very important distinctions. And then finally, with the notice of privacy practices, I know a lot of my clients are going to be really excited about this if it's finalized as a new rule. There is no longer going to be a need for you to have patients or clients sign that authorization that they received a copy of the notice of privacy practices. It provides a right to discuss with designated individuals. It eliminates that requirement that you have that you keep forms for 6 years in terms of those acknowledgement forms, and it's going to modify the content of the notice of privacy practices as well. So as these new rules come into effect or are finalized, we will be keeping up to date, modifying policies and procedures and forms, and then also doing refresher training for your privacy and security officers so that they fully understand what the new rules are. Now, something that I do want to note for you is that there are likely going to be some changes to the enforcement structure because of these new rules. And I also don't want you to forget about the high-tech safe harbor. Many of you all will remember that Congress passed this amendment to high-tech that stated that if you're using reasonable safeguards for your electronic protected health information, those type of safeguards that are noted in the industry to protect electronic health data, and you can prove that you've been having those standards in place for a period of 12 months, that can mitigate the amount that you may receive in fines if there's a breach. And that can also mitigate the amount of time that an audit may go on if your organization experiences a breach. And now we'll have an opportunity for our final skit of this training, and it relates to your personal devices.
Yeah, that sounds good. Hey, I'll see you tomorrow. You take care now. Talk to you later. Bye. Ooh, my phone needs charging. Anybody got an iPhone charger?
I have an Android charger.
Oh.
Android? Do they even still make those? I got your back. Here's my iPhone charger, but I don't have the knuckles, so you'll probably have to plug it into your computer to charge it.
Okay, not a problem. Got it. All right. Go. Got it here. Perfect.
So in that skit, obviously a lot of us have instances where we need to recharge these computers that we walk around with on a daily basis. I became aware of an instance where an employee did just what you saw in the skit, and they plugged their cell phone into their computer. Well, what they did not know at the time is that the computer was backing up the data from their cell phone. So when they were no longer employed with the organization, there was a tremendous amount of data that that employer had on that employee that was no longer with them. So it's something that you want to be really concerned about. I like to keep my private life private and my work life professional. So you want to make sure that you're not mixing those two things together and really protect yourself as an employee by not participating in that. Another instance that I'm aware of is where an individual who claimed to be wanting to listen to music at work brought in a portable storage device that had music on it, and she plugged that into her computer. Well, every time the system was backed up, it would ask, do you want to back up the information on the computer to this portable storage device? And for whatever reason, each time she said yes. Well, that wasn't an issue at the time that she was listening to the music. It became an issue when she got ready to divorce her husband. What happened was her husband found this portable storage device in their garage as he was cleaning up. He saw a tremendous amount of protected health information on it and was very excited to let the organization that she works for know that she had compromised all of this protected health information, which clearly would require disciplinary action. So what I would suggest is that you only utilize flash drives or any type of portable storage device that is provided to you by your organization, and that you not mix anything that you have in your personal life with the devices that you utilize for work. And then the tip that I'll leave you with relates to personal health applications. Many of us are using Apple Watches or other types of apps that we enjoy, and it helps us keep up with the calories that we're taking in or the exercise routines that we're participating in. And I want to caution you about that, because a lot of us on these apps, when we're signing up for it, we'll put in our birth date, our address, our email address, name, all of these things. But those apps are not subject to HIPAA and high-tech regulations. There's nothing that prevents those applications from taking your data and selling that to someone else. So it's really important that you be really cautious about what type of data that you put in these applications. Many times they'll allow you to skip some of those identifiers, but just be careful and knowledgeable that those apps are not always subject to HIPAA and high-tech regulations. So that concludes our training for today. I have our contact information listed on the slide. Please feel free to email me or call me with any questions that you may have.